Hi, everyone. I'm Steve Sandage. I'm a psychologist on the faculty in the School of Theology and also at the Danielsen Institute, which is a community mental health center on campus. And we have a project on mental health care, virtue, and flourishing that's funded by the John Templeton Foundation. This is a collaborative project. Jessie from the University of Denver, who's a multicultural psychotherapy researcher, is my co-PI. And we're looking at these issues in 4 different clinical settings at the Danielsen Institute, also out at the University of Denver, where Jessie has a lab, at McLean Hospital here in town, which the Flourishing treatment program for patients diagnosed with borderline personality disorder, a rather serious mental health condition, is now their largest clinic, has been quite popular with patients. And then also at the Center for Anxiety and Related Disorders here on campus. And this came together, again, out of realizing that the positive psychology movement had generated a ton of scientific data that was having hardly any impact on mental health care in the United States, which, as you probably know, tends to focus in a medical model on the alleviation of symptoms, which of course is really important. And we know psychotherapy is largely effective with that. What we don't know much about is whether psychotherapy really enriches people's lives in the sense of moving towards more meaningful lives, more connected lives, more generative lives. So this project is really to add to our strengths in looking at the alleviation of symptoms, to try to explore the impact on well-being and the rest of life in psychotherapy. And we're pursuing kind of a key overall hypothesis across the sites that looks at this question: is it possible, as many ancient cultural, philosophical, religious traditions suggest, that growth in certain relational virtues like humility, forgiveness, gratitude might generally contribute to both the alleviation of suffering and growth in holistic forms of flourishing? And is it possible that that process is mediated by affect regulation, among a number of other factors? So we're looking at that across these different sites with different treatment populations, different treatment approaches. We started out with also a study with therapists to find out what therapists think of these issues, with focus groups in a number of sites. And this surfaced a number of the questions that have to be addressed if this is going to get into mental health care farther. In general, therapists did think flourishing is relevant, but as these themes suggest, there's a lot of things that have to be considered: cultural diversity, systemic factors on oppression and struggles with flourishing, the need for clinicians to have humility and self-awareness about their own definitions of flourishing and how those might be different than clients, the conditions of training programs in clinical settings, which obviously impact the flourishing or less than flourishing of clinicians. And so this was a useful first step to begin to understand how clinicians might think about these issues. In our own context at Danielsen, we did a pilot test with some data that we had available before we started our clinical trials to see the impact of humility on growth in well-being and symptom alleviation. I had a student recently who said, you know, I heard that being in psychotherapy makes you more self-absorbed. I don't know if any of you have heard that. It turns out that actually, in general, this is a fairly large sample. We looked at in this pilot study, 778 patients. Across that sample, it's actually improvement in aspects of humility that make us more realistic about who we are and more receptive to inputs from others, that contribute to growth in well-being, reduction in symptoms, and some initial evidence that affect regulation can mediate that process. So that's been some encouragement for us to continue to test this with other clinical contexts, larger samples, and more refined measures. And so I'll close with this that illustrates another approach we're taking. We know that patients in mental health care are going to have diverse profiles on all of these issues. And there's a dual factor approach to positive mental health that's gaining some traction in the field that says we should be looking at symptoms and at well-being as dimensions that can be correlated, but are not so correlated that it is kind of a unidirectional effects, right? So we've done some pilot research with patients in our setting to explore what's called latent profile analysis. You can look at different patient profiles on this combination of symptoms and well-being. This was a relatively small sample from last summer in the context of COVID. A 5-profile solution fit the data really well. the big point here is, yep, we're seeing patients are in different places on this combination. And Sarah Crabtree led this study where we also interviewed some patients. We got qualitative data. We're finding out a lot about some of the dynamics that can impact this. Not surprisingly, as has already come up, social privilege effects ought to be on the screen for us as we look at that. There is some evidence it's easier to be in this flourishing, high well-being, low symptoms section if you're from the racial and sexual orientation dominant groups. There's socioeconomic factors that can come into play, but there's diversity across the different groups. So we're now tracking this longitudinally with larger sample and to look at how these profiles might move. Thank you.